Less than 1% of adults in the U.S. meet the criteria for DPD. It tends to affect women and people assigned female at birth slightly more than men and people assigned male at birth. In this video, we will talk about this disease, dependent personality disorder, by answering these questions. What is dependent personality disorder? What causes dependent personality disorder? Symptoms of dependent personality disorder. How's it treated? What is dependent personality disorder? Dependent personality disorder, DPD, is characterized by a pervasive psychological dependence on other people. This personality disorder is a long-term condition in which people depend on others to meet their emotional and physical needs, with only a minority achieving normal levels of independence. Dependent personality disorder is a cluster C personality disorder, which is characterized by excessive fear and anxiety. What causes dependent personality disorder? Although the exact cause of DPD is not known, it most likely involves a combination of biological, developmental, temperamental, and psychological factors. Experiencing abuse. People who have a history of abusive relationships have a higher risk of a DPD diagnosis. Childhood trauma. Children who have experienced child abuse, including verbal abuse, or neglect, may develop DPD. It may also affect people who experienced a life-threatening illness during childhood. Genetics. Someone with a biological family member who has DPD or another anxiety disorder may be more likely to have a DPD diagnosis. Certain cultural, religious, or family behaviors. Some people may develop DPD due to cultural or religious practices that emphasize reliance on authority. Symptoms of dependent personality disorder. A condition must fall into one of the following clusters to be classified as a personality disorder. Cluster A, odd or eccentric behavior. Cluster B, emotional or erratic behavior. Cluster C, anxious, nervous behavior. DPD belongs to Cluster C. Signs of this disorder include behaving submissively, relying on friends or family for decision-making, needing repeated reassurance, being easily hurt by disapproval, feeling isolated and nervous when alone, fearing rejection, being overly sensitivity to criticism, being unable to be alone, having a tendency to be naive, fearing abandonment. When alone, a person with DPD may experience nervousness, anxiety, panic attacks, fear, hopelessness. How's it treated? People who have DPD are generally treated with psychotherapy. The main goal of this therapy is to make the individual more independent and help them form healthy relationships with the people around them. Some of the therapy types that are most common with DPD include, but aren't limited to, the following. Psychodynamic therapy. This type of therapy focuses on the psychological roots of emotional suffering. Through self-reflection, you look into problematic relationships and behavior patterns in your life. Cognitive behavioral therapy, CBT. This is a structured, goal-oriented type of therapy. A therapist or psychologist helps a close look at your thoughts and emotions. Medicines. Medication can be used to treat patients with depression or anxiety because of their DPD, but this does not treat the core problems caused by DPD. Thank you for listening to all the information we want to introduce to you in this video. Do not forget to like, share, and subscribe for the HeInfo channel.